Hi there, my name is Noor El-Dassouki. I work at the University Health Network, Toronto General Hospital Multi-Organ Transplant Program, and my poster is on the socioeconomic status and how that influences having a potential living donor identified. So this analysis was kind of done on the basis that living donor kidney transplant is the optimal treatment option for eligible patients, as we know and as we've discussed at this event. But what we do know is that there's a lot of barriers that patients may experience in accessing living donor kidney transplant, some of which might have relation to their socioeconomic status. There have been other studies that have been done in the States and in Europe that have found that patients of lower socioeconomic status have a harder time getting a living donor kidney transplant. So in this analysis, we looked at patients who are on dialysis and referred for transplant in the Greater Toronto area, and we were seeing what impact their socioeconomic status and various factors around that question have on allowing them to have a potential living donor identified. So in this data set, we found that patients who indicated that they felt very safe in their home and neighborhood were almost twice as likely as patients who did not feel safe or felt somewhat safe to have a potential living donor identified. We also found that patients who had a vehicle or a car owned in their household were also twice as likely to have a potential living donor identified. And this would be at the time before their first pre-transplant assessment. And previous studies have shown that having a potential living donor identified at this time is a really good predictor of a patient's likelihood of actually getting a living donor kidney transplant over the long term, so over an 8-year kind of time period. So overall, we also saw that patients who had an overall high socioeconomic status, which is something that we define by using various variables, including income, education, household safety, drug coverage, and a few others. So patients who had a high socioeconomic status showed a trend towards having an increased likelihood of having a potential living donor identified, but this trend actually went away or lost significance after we adjusted for factors like ethnicity and immigration status, which indicates that, yes, socioeconomic status does impact having a potential living donor identified, but we do also see that there are other socio-demographic variables that can influence that interaction as well. So our next steps will be to look at some socioeconomic status indicators in a little bit more depth, including using the Ontario Marginalization Index and the Canadian Marginalization Index to analyze the association and hopefully work towards reducing socioeconomic barriers to living donor kidney transplant at UHN.